Hello and welcome back to another session of COVID-19 update. This is an informational video, so please seek medical advice from a medical doctor. After exposure to SARS-CoV-2 virus, individuals are asymptomatic for 7 days, during which time the virus is rapidly multiplying, can be detected by day 7. Time to detection coincides with appearance of symptoms such as coughing, fever, diarrhea, which can progress to breathing difficulties. If tested, the virus can be detected in the respiratory tract, that's in your nasal pathways, or in the throat for approximately 10 days and in the nasal pathways for up to 4 weeks. During this phase, the body is building up its immune response. Antibodies are proteins produced by the body to fight the bacteria, viruses, and funguses that infect our bodies. They are detected in the body 2.5 weeks after initial exposure. IgM is the first antibody that is produced as the body's first response to a new infection, and its job is to provide short-term protection. IgM antibodies increase for several weeks and then decline. IgG production, or the second type of antibody produced by the body, begins almost at the same time as the IgM and rises up for a few weeks before decreasing and stabilizing. IgG antibodies provide long-term protection against the virus. In people with normal immune systems, enough IgG is produced to prevent another infection. Vaccinations that are currently being deployed will use this process to prevent SARS-CoV-2 infections in those who have not been infected or reinfection in those who have already been infected. IgG can pass through the placenta, hence it will provide protection to the unborn child during pregnancy and to the baby that is born during its first few months of life. For most people, after a viral or bacterial infection, they heal and go back to normal. For others, after SARS-CoV-2 virus infection, they will heal and go back to normal. Others become what is known as long haulers. These long haulers will continue to experience COVID-19 symptoms for up to 6 months after the SARS-CoV-2 virus can no longer be detected. The symptoms they report include fatigue, breathing difficulties that sometimes require oxygen supplementation, chest pain, black fungus. This is observed in individuals with compromised immune systems that are taking high doses of dexamethasone, mental health issues including anxiety, depression, brain fog, fear of sleep, lack of sleep, increased heart rates, arrhythmias, clots that sometimes lead to strokes, chronic kidney disease, and integumentary systems or skin problems that include hair loss, COVID nails, and a burning sensation on the skin that lingers for a while. Can these individuals benefit from immune system boosters? The short answer is yes. Other than symptom management, long haulers are frustrated by the continued disruption of their lives, as well as the lack of treatments that is the current status. Vitamin D, Omega-3, and Cannabidiol are immune system boosters that may be possibly employed to help with COVID-19 recovery. In the next 3 slides, we shall determine how they can boost the immune system. So, what should you do if you test positive for SARS-CoV-2? First thing is you should buy a pulse oximeter, which is a device used to monitor your oxygen levels. Oxygen levels should be at 99% normally. If they drop below that, you should take note of the number, because when it reaches 90% and below, you need to check yourself into a hospital. The other possible immune boosters you can take are vitamins A, C, and E. This you can easily get from eating a diet rich in fruits and vegetables, especially red onions and kale or sukuma wiki, any grain such as beans and or nuts. Vitamin D, omega-3, and cannabidiol are discussed in this presentation, so please revisit the slides before. Sleep is an important part of the immune system. When you do not sleep enough, then your immune system will break down. So catch adequate amounts of sleep. The last but not least thing is how do you prevent the virus from spreading? At first and foremost, you should avoid indoor environments. If you have to be indoors, wear a mask. The next thing you can do is improve ventilation in the house. So keep your doors wide open, keep your windows wide open, so that there is adequate aeration going on around you and around the people that you live with. On this slide, we review vitamin D. Vitamin D is a hormone that is known to modulate the immune system. The takeaway message on this slide is know your vitamin D status by requesting a vitamin D test. The recommended circulating levels of 25-hydroxy-D or vitamin D in blood are above 50 nanograms per milliliter, or in some countries 126 nanomoles per liter. If the test is not affordable or available, please supplement daily or weekly anyway. I usually take up to 5,000 units or 125 micrograms of vitamin D3 per day. Vitamin D3 is derived from dietary sources such as milk, meat from grass-fed cows, fish oil, egg yolk, and mushrooms. It is also synthesized on our skins from cholesterol by sunlight. Dietary derived cholecalciferol and skin-derived cholecalciferol are converted to 25-hydroxy vitamin D2-3 in the liver and to 1,25-dihydroxyvitamin D3 in the kidneys or in immune cells. Vitamin D deficiency with levels lower than 50 nanograms per milliliter is associated with increased respiratory tract infections such as flu, common colds, and even death sometimes. Supplementation was used to treat tuberculosis in the late 1800s and early 1900s. Today, supplementation with vitamin D prevents respiratory tract infections because it is known to improve innate or non-specific defense mechanisms in our body. Innate or non-specific defense mechanisms include the skin, which is a physical barrier that protects us from harmful external environments, chemical secretions in the blood, and immune-related white blood cells that attack foreign particles or pathogens, such as viruses or bacteria that threaten the body immediately or within hours of attack. Vitamin D also improves adaptive immunity or long-lasting secondary defense mechanisms, such as antibody-producing cells that are recruited to help fight the foreign pathogens in the long term. With COVID-19, death was associated with old age. Older people tended to die in higher numbers. Gender, males had poorer outcomes than females. Obesity, more obese individuals were more likely to be hospitalized. Ethnicity, dark-skinned individuals were more susceptible to the virus. The populations mentioned above were also likely to have low levels of vitamin D. In countries with higher levels of vitamin D in blood, there was a lower likelihood of testing positive for SARS-CoV-2 and or getting hospitalized with COVID-19. Vitamin D3 acts by activating a protein known as vitamin D receptor, which in turn activates proteins known as Cathelicidins and Defensins that are known to make holes in invading microbes. These include viruses, bacteria, or fungus. They also disrupt their ability to make energy that enables them to act harmfully in our bodies. Vitamin D also decreases inflammation in our bodies by decreasing cytokine production, by secreting mucus, and by decreasing neutrophil and eosinophil movement from capillaries into the lungs. Neutrophils and eosinophils are white blood cells that are deployed from the blood vessels into the lung space to fight pathogens. And therefore, it will protect against acute respiratory distress syndrome. Separately, vitamin D protects blood vessels from immune cells themselves, and hence decreases the injury caused by cytokines, which by releasing chemicals such as nitric oxide, which helps to trigger protective responses in the blood vessels, for example, by allowing them to dilate and not create gaps that allow these cells to move out of this space. The second immune booster is cannabidiol. How does cannabidiol modulate your immune system? So cannabidiol, or CBD as it is commonly known, is one of 100 chemicals in the cannabis sativa plant, also known as hemp or marijuana. In COVID-19, a dysfunctional immune system leads to excess release of cytokines and pro-inflammatory proteins and chemicals, which are a hallmark of cytokine storm, which are closely related to lung injury and multi-organ failure, which leads to death. Hence, available treatments such as antivirals, e.g. remdesivir, and steroids, e.g. dexamethasone, may not be enough to ensure complete and quick recovery of COVID-19 patients. CBD modulates the immune system by decreasing cytokine release, mediated lung inflammation and scarring, or which is also known as fibrosis. CBD also stops the migration of white blood cells from blood vessels into the alveoli, as previously described in the COVID-19 video. CBD also directly prevents entry of SARS-CoV-2 virus into cells, thus decreasing the severity of COVID-19 symptoms. Last but not least, CBD decreases both innate or non-specific mechanisms of defense, as well as adaptive or secondary mechanisms of defense by decreasing cytokine storm when they interact with specific proteins in the lung and blood vessels known as adenosine type 2 receptors. In this case, CBD will decrease the cytokine storm by decreasing pro-inflammatory mediators such as TNF-alpha, IL-6, MCP1, and MIP2, which are known to cause injury in the lung. For the last 50 years, we have been eating fat-free foods that are high in sugar or highly processed carbohydrates such as bread, rice, and cake, and drinking a lot of sugary drinks, including juices and soda. The results include high incidences of type 2 diabetes, obesity, and increased heart conditions such as heart attacks and strokes. These diseases are directly linked to hospitalization with COVID-19. Specifically, individuals with type 2 diabetes and obesity have increased expression of ACE2 receptor in the lung and in the heart, and this receptor, or the ACE2 receptor, is the SARS-CoV-2 gateway into the cells of the body. High levels of bad fat or obesity are also linked to activation of the immune system, characterized by white blood cells that are dysfunctional. This leads to cytokine production cytokine production, which are proteins that increase inflammation, which are associated with severe lung disease and subsequent multiple organ failure. This is also associated with high risk of death following hospitalization with COVID-19. Research indicates that people who eat seafood high in omega-3 3 to 4 times a week are less likely to suffer from depression, arthritis, or even die of heart disease and ischemic strokes. Although omega-3 supplements don't appear to reduce the risk of heart disease directly, high daily doses of omega-3 do reduce levels of fats in the blood. Triglycerides are dietary fats which when in excess can raise the risk of heart disease. Children born to mothers who had taken fish oil were less likely to develop asthma or persistent wheezing or other allergic conditions in early childhood, and this was most noticeable in children whose mothers had low levels of EPA and DHA, which are two omega-3 fats that we should be ingesting before they started to take the supplements. Sources of omega-3 include fish oil, fish itself, krill, which is a form of underwater fish, eggs, beef, flax, chia seeds, walnuts, and those are the highest sources of omega-3. In addition, if you ingest hemp seeds, you can also be ingesting high levels of omega-3. Last but not least, of course, eating 3 to 4 servings of seafoods high in omega-3 can improve myocardial infarction, blood pressure, ischemic stroke, bronchial disorders, asthma, allergies, depression, inflammatory pain, especially with arthritis or back pain. And in this case, most of these diseases are associated with immune dysfunction. So omega-3 can improve your body's immune functions.